An American doctor suffering from the Ebola virus in Liberia has been flown home for treatment. Dr. Kent Brantley is the first person ever treated for Ebola in the U.S., but the country is equipped to help him. He'll be kept in strict isolation until he's cured. And a second American, a female missionary also suffering from Ebola in Liberia, will be flown home shortly. As Jennifer Johnson reports, it comes as health authorities in Africa scramble to prevent the virus from spreading even further.
A specially equipped ambulance arrived at Emory University Hospital around lunchtime, and to the surprise of many, Dr. Kent Brantley on the left slowly walked into the medical center for life-saving treatment. Brantley is the first person infected with the deadly Ebola virus to ever be on American soil. Missionary Nancy Whiteball, who worked in Liberia with Brantley, will also be transported here.
I will be one of the individuals who will be coming into direct contact with the patients. I have no concerns about either my personal health or the health of the other healthcare workers who will be working in that unit.
Earlier in the day, a jet with a high-tech biocontainment area flew Brantley to a Georgia air base. That jet is already on its way back to Liberia to pick up Whiteball. Emory has one of the most sophisticated isolation units in the world. Bodily fluids are tested in the unit itself. It also has negative pressure, so no air goes into the hallway or another patient's room. Doctors say they've prepared for this for years.
We have a unit that's staffed with experts, both physician experts and nursing experts, that are really key players and understand the infection control practices necessary to maintain the safety, not just of the unit and all the other patients, but the general public as well.
Ebola has killed more than 700 people in West Africa and infected over 1,300. The World Health Organization says the epidemic is spreading faster than it can be contained. The organization's director met with the presidents of Liberia, Sierra Leone, and Guinea to talk about stopping it with the world's help.
You must support the extraordinary measures and the determination of the three presidents and their countries to help them to stop Ebola outbreaks.
U.S. and Canadian officials are urging residents not to travel to West Africa. But stopping this strain of the virus, the deadliest Africa has ever seen, will take time, as researchers search for a vaccine that so far has eluded them. Jennifer Johnson, Global News, Washington.
This latest outbreak of Ebola has a fatality rate of about 60%, so patients are able to survive, but it depends on how they're treated and where. The problem is the public health infrastructure in countries hardest hit by Ebola is woefully inadequate, compounding the problem: misinformation and fear. Burial often takes place without proper precautions. Treatment is available, but it requires intensive hydration and, most importantly, strict isolation in an advanced intensive care unit.